Hi, my name is Erica Casada York. I am a midwife at Professional Gynecological Services here in Brooklyn. I would like to talk with you all today about ovarian cancer. September is Ovarian Cancer Awareness Month. This is obviously a big concern for many people because ovarian cancer is very serious and can sometimes be difficult to diagnose. And unfortunately, there actually are no screening tests for ovarian cancer. We have screening tests for breast cancer, like a mammogram. We have screening tests for cervical cancer, which is a pap smear, but we don't actually have a good screening test for ovarian cancer. So if this is something that is of concern to you, definitely pay attention. One of the best things that you can do to reduce your risk for ovarian cancer is to keep up with doing annual gynecological visits. Even if you're not due for a pap smear, even if you don't have any particular concerns about your periods or anything else that would require you to go to the gynecologist, it is a good idea to stop by once a year just so we can check in with you, see how you're doing, answer any questions, do any tests that you're due for, and just kind of make sure that everything is going okay inside and out. Because there aren't any screening tests for ovarian cancer, having that kind of one-to-one time to kind of talk through how you've been feeling and what's been going on with your body is definitely very, very helpful. If you haven't gone in for an annual visit in a little while, maybe you put that on hold because of the pandemic and here we are still going, now would be a really great time to go back. Reasons why you might want to come in and see your GYN provider even if you're not due yet for an annual exam. Sometimes early signs and symptoms of ovarian cancer can include things like change in your appetite, having a decreased appetite, or having a hard time actually physically eating even when you're hungry, feeling like you're full even if you're not full, having a bloated feeling that doesn't seem to necessarily be just PMS or hormonal but kind of out of the blue, especially if it persists over time. Changes in your urination, feeling like your bladder is full even if it's not, feeling like you have to go quite frequently, feeling a strong urge to use the bathroom. These can also be signs of a urinary tract infection, but if you've been worked up for an infection and it doesn't seem to be that, if you're not having any pain with urination and it's just this sort of bladder fullness and more frequency, that potentially could be suspicious. Other signs might be that you're not really gaining weight all over, but your abdomen has kind of increased in size. And then obviously anytime that you're having pain really anywhere in your pelvis or in your abdomen, and that could be your ovaries sit quite low in your abdomen, but you can even sometimes have pain that is higher up above your belly button, closer to your rib cage, and sometimes that is suspicious as well. Any of these things that are going on, of course, they could have many possible explanations, and I don't want you to just jump immediately to, oh my goodness, this is the worst thing. Erica said that it was going to be cancer and it's cancer, but it's worth checking out because all of these things sound very uncomfortable and it would be nice to feel better no matter what the cause turns out to be. Some of you may have a family history of ovarian cancer or breast cancer or both, and you may be interested in doing some genetic or hereditary cancer risk screening. That is a service that we offer here in our office. It also is very common nowadays. When these tests first became available, a lot of people were very hesitant to do them because there was a lot of fear of, if something comes back positive, am I going to be denied coverage for a pre-existing condition, and so on and so forth. Now there are legal protections that in the United States that say that if you do have one of these tests come back that you're at high risk for such and such type of cancer, that you cannot be discriminated against in workplace or in healthcare for those kinds of results. So keep that in mind. Also, interestingly, if you have a family history that includes certain kinds of colon cancer, that might also increase your risk of ovarian and or breast and or uterine cancer in the future. So if you want to discuss your overall hereditary cancer risk, absolutely please bring that up the next time that you go in to your GYN provider or to your primary care provider. If you've already done this testing and you know based on your results that you are at increased risk for ovarian cancer in particular, please bring that to the attention of your GYN provider. For somebody that we know is at increased risk, there are certain tests that we would like to do periodically once or twice a year to follow up with ultrasound and with certain blood tests to see if any of those levels are becoming concerning. Another thing to keep in mind is that there are several factors that can decrease your risk for ovarian cancer over your lifetime. One of these things is using birth control pills. Other methods of hormonal birth control do seem to have this protective effect, but the birth control pills, the typical, what you think of when you think of a birth control pill that contains estrogen and progestin, these have been shown over decades to have a very definite decrease in risk of ovarian cancer over a person's lifetime. Other things that are protective against ovarian cancer, the more times that you carry a pregnancy to term, the more protection you have against ovarian cancer. The more months that you spend breastfeeding a baby, the more protective it is against ovarian cancer. Having your tubes tied or having your tubes removed, even leaving the uterus and the ovaries in place, even though the ovaries are still there and the tubes are gone, also substantially decreases your risk of ovarian cancer. A lot of ovarian cancer seems to have some origin or some important growth that is in the fallopian tubes themselves. This is likely at play when we take the tubes out for some unrelated reason, or it is becoming increasingly common for people who know that they are at particular risk of ovarian cancer to go ahead once they have finished having children, they know they don't want to have any more children, to go ahead and have the fallopian tubes themselves removed. I'm not saying that you should make the decision to have a baby and breastfeed a baby just for this reason. Those are obviously big decisions. You should not decide to have your tubes taken out just for this reason. That is a huge and life-altering decision. But these are some things that if you were thinking about doing this anyway, it's nice to know that this does offer some protective benefits. If you're not interested in being pregnant right now at this moment, and if otherwise you're a good candidate for birth control pills, it might be worth going on birth control pills for a short or long amount of time, even if you technically don't need that as a contraceptive benefit, just to access that cancer protection benefit. One of the most important things that we can do for September Ovarian Cancer Awareness Month is really to spread the word, make sure that we and people that we love and care about are aware of ovarian cancer as something that does exist and, again, can be very, very difficult to screen for. It is one of those cancers where early detection does seem to make a really, really big difference in people's quality of life and length of life. And so if you have any concerns, even if you just want to talk about your theoretical risk, please, please, please come, speak with your healthcare provider. I would love to see you. Any of us at the office would love to see you. Feel free to leave a comment and share the video with your friends. Thank you. Bye.